Come here, V. Come on, go sit down. Come sit down. Come sit down. Come on. Come on. This is Veronica. A guy brought her in one afternoon and told me that he found her wandering in Seal Beach. So I took her as a Seal Beach stray, and we noticed over the next couple of days that when she would walk, her head was always down, but she would throw her back leg out, almost like she didn't quite know where it was. You know, she couldn't really control it. So we took her to the vet and we did some tests, and we ended up having to go to a neurologist. We saw Dr. Berry out at Southern California veterinary referral, and she was diagnosed with Wobbler's syndrome. And it's a syndrome that lots of Dobermans get. And there were 3 different types of surgery that Veronica may have needed. They went from expensive to really expensive to extraordinarily expensive. And we were lucky, at least in the sense that what she needed was the least expensive and probably the least, I guess the least difficult for her to recover from. And she had an MRI, was diagnosed, and then she had the surgery, and you can see underneath her neck, they went in, and it's just like a zipper. She's got all these stitches down here, and it's only been about 2.5 weeks since the surgery. She's supposed to be calm, but as you can see, she's not real calm. We had her behind an area blocked off, and she just wouldn't stay away from the other dogs and the people. So we figured it was better than having her try to jump out of that to open up at least back here and let her wander around. She's doing pretty well. She gets to go outside for 5 minutes, 3-4 times a day for potty breaks. And she's just the sweetest thing ever. She's a purebred Doberman, and a lot of insurance companies, apartments, they breed ban against Dobies. And she is the most gentle, sweet thing ever. All she wants is a person. She comes up and sits right next to you. This is like her favorite thing, her favorite position. She'll sit like this all day long if you'll sit with her. We have a bed close to the desk, so she lays there. So, you can always put your hand down and touch her. She always wants to be where someone is. She has a lot of people that want to adopt her. She's really beautiful. She's very, very sweet. She's about 5-6 years old. But the difference for her is that she's kind of a different breed, and she has just a really sweet personality and temperament, where Cash and Dallas, they're Chihuahua and little rat terrier mixes. So, that makes a difference. People aren't as inclined. Chihuahuas just don't get the same kind of, adoption action that other purebreds or dogs that, are really beautiful. If I could take dogs, I'd take these 2 little ones in a heartbeat. Wouldn't even think about it. Yeah. She'll be adopted as soon as, I'm really ready to let her go. Once the stitches come out, she'll probably get, maybe a 10-minute walk. And we'll maybe put her available to a very specific kind of home. But I'm not really in any hurry. I want to make sure that everything goes well for her. The surgery was really expensive. And so far it's doing really well. I don't want anything to be wasted for her. Well, if it was the perfect home, she could probably go home in 2 or 3 weeks. But recovery time normally, with other disc surgeries that we've done, complete time is like 6 months, sometimes even longer, depending upon the type and what they've done. So it can be quite a while before, you know, she's completely healed. But I think for the most part, you know, I think she could go home to a very specific family and specific situation where they would actually, you know, follow the rules, where 10 minutes and, you know, outside is going to be enough. It's really hard to get special needs dogs adopted, whether it's behavior or for medical reasons. There's not a lot of people that want them, and as a, you know, as a shelter, it's very difficult, because for us, we don't euthanize for time or space, you know, so they stay with us until, you know, until they go home. And we're very, very small. And when they have medical needs like this, it's hard for us, you know, to be able to do it. But we somehow find a way. I mean, well, there's no other option for us. I mean, there's zero options for her other than to do the surgery and find a home for her. Somebody that is home a lot, or if they're out and about, that they take her with. She wants to be with a person constantly. She's not a dog that really wants to spend time alone. So she needs somebody that's going to take her to work, somebody that's going to take her in the car, someone that's home a lot, spends time with her, walk her, just be with her. She's not an outdoor dog. What ended up happening is about a week after she came to us, a woman just showed up and asked if we had a Doberman here. And we said, yeah, and it turned out that her son had brought Veronica to us and had said that she was a stray when in fact she wasn't. So, you know, we take them, we love them, we fix them, we find homes. And when they're sick and maybe they won't find a home, we keep them until it's time. You know, when we have that situation where it is time, you know, I take them and I hold them and I tell them that they're loved and that their life mattered. They will always know their life mattered. You know, and you can see these guys, I think they know that. They're very happy here. But it's just a way station. It's not a real home. Yeah.
Thank you.
You know, we always try and have dogs in the office as they sort of cycle through, whether they've, you know, passed on or they've found a home. We always try and put in the most special needs that we have. And, you know, we always have anywhere from 3 to 4 dogs in here. Sometimes it's difficult for the other volunteers, you know, like the people that work the phones, because they're all barking and getting excited and all of that. But the biggest expense that the shelter has is medical, and this surgery for her was about $7,000, and the surgery for this guy was about $6,000 for Dallas. And we operate almost exclusively on donations. We get a little bit of money from the city a year for, for housing the animals, but it's very, very small. It almost doesn't cover 1 month of vet bills. So, we're appreciative of every cent that we get, but the biggest donation that we need is actually money for vet bills. We do get discounts from the vets that we use, but, we understand that, they need to stay in business also, and they're all very, very good to us, but it's really expensive. We have lots of dogs that, have special needs. From, we have a dog named Sadie who has separation anxiety. She's been adopted 4 times, and she's on Prozac. We have, other dogs that have had hip surgeries, knee surgeries, elbow surgeries, all kinds of surgeries. It's really hard. People that have donated, we're so grateful that, they give to us, being the kind of shelter that we are. We don't have, I guess the exposure, the advertising team, fundraising team behind us, like some other organizations do. So we struggle a lot, but we are very grateful for anybody that's given us a dime. We have kids that have, for their birthday parties, they ask for donations to the shelter. We have, drives that people do for us for, they bring in stuff from our wish list we really, appreciate. But the biggest hit that we have is medical expense. So everybody that's ever given us anything, from a roll of paper towels to any amount of money, we really, really appreciate. And it goes to help dogs just like the ones that you're seeing. Everyone gets adopted. So the money that you give sometimes to different organizations go to support other things within the organization. All of the money that you ever give to us goes to the dogs. We're all volunteers. We have some kennel attendants that are paid help, but on the dog side we only have 4. They work an average of like 15 hours a day. And that's it. That's all of our paid time. That's the only thing that it supports. Otherwise, everything goes to the animals. We don't take salaries. We don't take trips. We don't do anything. We just pay for their care. So donating, to a place like this, it really makes a difference. We're donating to other large places. They have a big team behind them. We don't. So we love everybody, huh? Do you guys want to say thank you to everybody? Huh? You going to say thank you? Huh? Let's say thank you. Huh? That's probably it. Thank you for visiting me. Thank you. Thank you, everybody. Yeah. Say thank you. Come say thank you. Bye-bye. Bye-bye. Say thank you. Thank you for visiting. Yeah.